How does hair regenerate after reproductive cancer treatment? When someone undergoes treatment for reproductive cancers like testicular or cervical cancer, hair loss can be a common side effect. But the good news is that hair often grows back over time, following a natural biological process. The pattern of hair regrowth depends on the type of treatment received, but most recovery follows similar steps. Chemotherapy is a common treatment that can cause hair loss because it damages rapidly dividing cells, including those in hair follicles. Chemotherapy drugs attack cancer cells but can also affect healthy cells, leading to hair thinning or baldness. Fortunately, most hair follicles survive this damage, which means hair can regrow once treatment ends. Typically, soft, fine hairs start to appear about 4 to 6 weeks after finishing chemotherapy. These initial hairs are usually lighter and softer but gradually become thicker and more like the original hair over several months. The rate of hair growth is generally about 1 centimeter per month. So, within 4 to 12 months after treatment, many people see significant hair regrowth. Complete restoration of hair, including texture and color, can take from 6 months to 2 years. During this time, hair may look different from before, sometimes softer or with a different curl pattern, a phenomenon known as chemo curls. Despite these changes, most people find that their hair eventually returns to its previous state or adapts to a new normal. Hair loss during treatment often follows a predictable pattern. For those receiving chemotherapy every 2 to 3 weeks, hair thinning usually begins around 2 to 3 weeks after the first dose and peaks by the end of the second cycle. The severity depends on the specific drugs used. Some agents, especially taxanes, have a higher chance of causing permanent hair loss, but this is relatively rare. Research has shown that hair regeneration after chemotherapy involves more than just follicle survival. Restoring blood flow around hair follicles, called angiogenesis, plays a key role. A protein called ETV2 helps form new blood vessels, which improves nutrient delivery to follicles and supports hair growth. When blood vessel formation around follicles is enhanced, hair can regrow more effectively after treatment. It's also important to note that other treatments like radiation therapy can affect hair growth. Radiation to the pelvic area may cause hair to grow back slowly or not at all if high doses damage the hair follicles permanently. Hormone therapies used in reproductive cancers often cause thinning rather than total hair loss, and this thinning usually reverses after stopping treatment. Emerging strategies to support hair regrowth include topical treatments like minoxidil, which has been shown to speed up hair growth in some cancer patients. Oral minoxidil is also being studied. Low-level light therapy, which uses specific wavelengths of light to stimulate hair follicles, has demonstrated promising results and can be used at home safely. Scientists are exploring drugs that temporarily protect hair follicles during chemotherapy, such as CDK4/6 inhibitors, which can make follicles less vulnerable to damage. For those experiencing hair regrowth, patience is key. Hair may need to reach a certain length before it can be styled or cut. Gentle scalp massages might help improve blood flow, but it's best to discuss any new hair care routines with a healthcare professional. Always consult your medical team before trying any treatments or interventions for hair regrowth, as individual experiences vary and personalized advice is essential. Remember, hair regrowth is a gradual process, and support from healthcare providers can help manage both physical and emotional aspects during recovery.